Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to this channel. In today's home exercise tutorial, we are going to do part 2 in a series that I started last week on a pretty common movement problem that I'm calling lateral trunk flexion. If you haven't seen that video, I highly recommend that you stop this video and go back and watch that video because it's going to make this one make a whole lot more sense. But we talked about a few different reasons why someone who has hemiplegia or weakness on one side of the body due to a brain injury or a spinal cord injury or a lesion from MS, why you might develop this side bending where the shoulder and the hip, when you're looking straight into a mirror, looks closer together on one side than it does on the other. So I went into some reasons why someone might develop this, which might help you to identify if you are someone that is dealing with this. And then we started to talk about some exercises that you can do to elongate that side of the body and retrain your body to be more symmetrical or to have equal distance between the shoulder and the hip on both sides. Or another way to think about it is to have, if you looked at your shoulders, if you drew a line from shoulder to shoulder, have a horizontal line across your shoulders. And if you drew a line from one hip bone to the other hip bone, that line would also be horizontal to the ground. That is ideal. Now, everyone, whether you've had a stroke or a brain injury or not, is not perfectly symmetrical. However, after a stroke or a brain injury, or if you do have hemiplegia, it seems to be a little bit more dramatic, and it really can interfere with the movement in the arm and the leg on that side of the body, or the movement retraining that you might be doing, as well as it can lead to a lot of problems down the road. 5-10 years down the road, if you don't address it, it can lead to more structural problems, low back pain, some arthritic changes, things like that. So it is something that's good to address. The earlier you start to address it, obviously the better. But all that being said, most of that we went over in last week's video. What we're going to do in this week's video is go over some more higher level activities to more or less just straighten your body out or eliminate as much of that side bending as possible. But before we dive into that, if you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll get notified every time I upload new videos. And now let's go ahead and dive into part 2 of the video that I started last week. You can go right into what we call lateral pelvic tilt. Now, the important one to do is to elongate the involved side of your body. If you're someone that has neglect that I talked about earlier, or any type of inattention to that side of your body, this will be extremely challenging at first because you are shifting your weight more towards your involved side, which is a little bit scary for a lot of people who do have that neglect. However, it's a great activity that is safer than in standing, so it is a good progression if you're trying to relearn how to be more aware of that side of your body. It is a good progression prior to standing up. Then you're just going to do these what we call lateral pelvic tilts. And then we're gonna move right into standing. So now once you're standing, same thing. We are gonna do a couple of stretches, and that is because even if you are nice and lengthened on that side of your body, when you go to stand up, as I mentioned earlier, that spasticity can kick in and it can cause some involuntary muscle contractions in the muscles that shorten that side of your body or create lateral trunk flexion. So I do recommend finding some type of a stretch in standing before you go on to some of the active activities that we're going to do in standing. A couple of the ones I like is just weight bearing on your involved arm. I've shown this in other videos. If you need to put something on your elbow to keep it straight, do that. Or if you have a counter or you have something that's a little bit taller, you can set your elbow up on that with your arm bent if you can't get your arm all the way straight, and you're still gonna get some nice lengthening on that side of your body. The other thing that I recommend in just standing before we get to stepping is starting to learn how to use a two-handed device. So if you need to strap your hand to a walker, strap your hand to a walker and just stand. Learn how to stand with both hands on something. I think it's extremely beneficial to kind of break that learned non-use just a little bit. Maybe you never get to walking with it, but at least you're starting to create more symmetry just by standing and holding a two-handed device. The way you can progress this, if you really did want to work on getting to a point where you could walk with a two-handed device, is change your foot position. Go into stagger standing, go into tandem standing, put your feet in different positions and just get comfortable with your feet in all of these challenging positions with both hands on an assistive device without letting that hand draw up or letting that side of your body crunch up. So if you need to use a mirror to know whether or not that's even happening, definitely do this in front of a full-length mirror. So for those of you where you've got really good symmetry in sitting, you've got really good symmetry in standing, but when you see yourself walk, you really crunch up on that side of your body when you're actually trying to swing that leg through, that is extremely common. The progression that I like to do is just break down the walking pattern just a little bit, and in each snapshot of that walking cycle, try and put your body in that position and not let that side of your body crunch up. So the way I like to do that is using a step stool, starting with a low stool and moving to a higher stool. Just putting your involved leg on that step and getting your hips and your shoulders parallel to the ground. In most cases, that hip is going to drop and that shoulder is going to drop down on your involved side. So you're just standing in these positions. Again, these are just snapshots of the walking cycle. We're just breaking it down and relearning how to have your foot in these positions without that side of your body crunching up. The next snapshot I would do is now putting that step behind you and doing the same thing. You're just going to hold a position with that foot a little bit behind you, which is one of the stages of the walking cycle, and not letting that hip draw up or that shoulder drop down. So those are just static positions. Now to make that more active, and these are exercises that I have shown in other videos, but for different reasons, but again, they are great, is using a furniture slider. So furniture slider makes it easier to move the involved leg without feeling like you need to hike that hip up to clear your foot, which is a lot of times what happens, which creates that adaptive shortening, is just that over time, a lot of you that are walking a lot, sometimes you'll just hike that hip up to make sure that you clear your foot. This activity is for you. Start with a furniture slider. Your goal is to think relax. A lot of you are just too active through the swing phase on that side of your body, and it is causing your body to crunch up on that side. So you're just going to relax and just try and bring that leg forward without you really having to worry about lifting it up off the ground. So there's less of a chance of you hiking that hip up if you have something under your foot so that it won't get caught on the ground. And you just want to do this over and over and over again. The other way I like to do this is with a skateboard. I've shown the skateboard before. I definitely think it's a great activity. And that is it for this video. I hope all of that made sense. I hope that this little mini series kind of helped you to kind of give you some fresh ideas for those of you who have been at this for a while of things that might be helpful to incorporate into your home exercise program. If you have any questions about anything I went over in last week's video or in this week's video, definitely leave those in the comments below. I love answering your guys' questions, and I love it when you guys answer each other's questions, because it's always good to hear from someone who's kind of in in a similar situation as you. So I love all you that are sharing your experiences and helping others out in this community. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button. Turn on that notification bell so that you'll get notified every time I upload new videos. I now offer 2 membership programs here on YouTube. If you like the videos that you're seeing, you will notice that all the videos are free, and I do that for a reason. There's a lot of people in other parts of the world, and even in the US, who have either run out of insurance or don't have access to neuro rehab or don't have the means to pay for neuro rehab when you run out of your benefits. So I want to continue to be able to provide these free videos for people who might be in that situation. If you like that mission, you want to support that mission, and you have the means to do so, all you need to do is click on that join button right below this video. The second membership is actually for practitioners. I'm getting a lot more emails and comments from therapists who have questions about things. Again, I said it last week, and it is worth reiterating. If you are a clinician, this is not gonna do it. If you wanna be able to really help your patient, you don't necessarily need to join this membership, but I strongly encourage you to invest some of your time and money and resources in your continuing education if you are seeing a high volume of patients who've suffered neurologic injuries. But if you're not ready to take the leap into signing up for one of the NDT certifications or a full weekend course, definitely join this membership program. I'd love to be available for you as a resource and be able to provide more in-depth videos for practitioners, teaching you more of the skilled component of neuro rehab. So again, you can also click on that join button below to join that membership program. And that is it for this video. I enjoyed spending time with you all today, and I look forward to seeing you all in the next video.